significantly in India. But what was your observation about what Mark was saying, that it almost became a political issue in the context of to vaccine, the anti-vax, as they called it, movement? What was your thought about that objectively?
I think there was no proper risk communication, and I think there was certain violation of basic principles also, particularly discounting natural infection. I mean, it was well known that people who have recovered from natural infection, and subsequently there were studies from Israel, and now of course there are very good studies now that person who has recovered from natural infection has got very strong immunity. So mandating vaccine for them, I mean, people would start losing trust in the public health institutions. And unfortunately, there is hesitancy of other vaccines also now. Now I am seeing cases in my hospital. I was surprised, a 4-year child getting tetanus. I mean, this is an important vaccine where the mortality of maybe 20% from tetanus. 4-year child, perhaps so much hesitancy or pushback that and the COVID in a child or a young person, the mortality is 1 in a million, whereas tetanus mortality is 20%. Now we are seeing measles deaths in India. So many important vaccines are being neglected. So I am a pro-vax, but as a pro-vax, I feel that this pushing mandates of a vaccine, which is we don't know it's an experimental vaccine, particularly in groups which are at negligible risk. So I think I also started having my doubts whether the scientific principles are being followed or not, epidemiological principles are being followed or not. So these are some things which perhaps the loss of trust in the public would affect the uptake of more important vaccines, which we are already observing in India. And COVID vaccine, as I said, after the end of the second wave, in fact, in September 2021, before the vaccine was rolled out for below 18 years old, 80% in surveys all over India, 80% of young people already had antibodies before the vaccine was rolled out for them. So they had already reached herd immunity. It was not indicated. And in a poor country, I am also concerned about the health economics, which I think the public health authorities have to balance the priorities. We have got other diseases, other infections like dengue and Japanese encephalitis and many other diseases which are more lethal. And the resources on vaccinating, and as I said, measles vaccination was neglected. Tuberculosis detection was neglected. 40% less cases of tuberculosis were detected in India because of this mass vaccination drive. So now we are having a resurgence of drug-resistant tuberculosis. So as a public health measure, we cannot chase a virus and chase for mass vaccination with such lethality. So I mean, it was a very unbalanced public health practice or public health policies. So this is my
Dr. Banerjee raises a very interesting point, and frankly, this is something that I think the World Health Organization and public health agencies globally are going to have to bear the brunt of. The bigger issue in this, and I'm glad you said you're pro-vax, Dr. Banerjee, but then you qualified that by saying but. And as soon as I learned in university that as soon as somebody says but, you negate what they said prior to that. My point is, we should all, as healthcare professionals, we should be bloody minded about the necessity to have the kind of thinking and the mindset around being pro-vaccine regardless. And I agree with your statement that what this ended up doing is it pitted people against each other and saying things like, well, I don't need a vaccine for tetanus or for other issues that are really hurting people as well. My point, though, on this is that the World Health Organization owes a responsibility now, based on what's happened here, to be better communicators at this. They've taken an issue that's really scary and overcomplicated it. And that, to me, is something that I think they're going to have to pay the price for. And what we've been saying, and I know that you, Philip, and you, Shankar, and I have had a lot of active interest globally to make sure that best practices sort of permeated the World Health Organization going forward. That ought to be the way that we need to think how we remedy this situation in future.
Yeah, and Shankara, I'm going to have to ask you to try and find a way to to settle the upset masses. There are a lot of people who are very upset about what they think is coercion, what they think is a degree of control, financial strategies by big companies. Can they be reassured, or were they right? This is one of the big issues that we have to face.
Well, I think, Philip, there are certain big players in global health that have questions that need to be answered. And that's where everyone will settle. As long as the questions are deflected and not answered, the conspiracies will continue. So these are valid questions that people have. And those involved in public health need to come to the table and sit and discuss it. If there are vested interests, if people have overplayed the role that they have in public health, these need to be addressed. So I think some of the concerns are valid. This deals with people's freedoms. It deals with social structure. So I think it has great impact for the future of healthcare, for the future of society as a whole. In South Africa, we went through a rough time trying to get our freedoms. And to have anything take away that freedom, we want to do the right thing, but we'll question. We don't trust our public health authorities, neither our politicians. And so we question. And I think the right way forward would be to allay those fears rather than to defer them or casticize it. Make sure that everyone takes responsibility for any omissions or commissions. And if you're in a position of power, then you need to be able to be accountable for any actions that were taken to the population that you are actually instituting those actions on. It's in all fairness.